How do we, as billing professionals, help protect providers from MIPS penalties?
Great question, Adnan. I think that billing professionals are in a unique position to provide protection for their clients through guidance, information, and service in support of the quality payment program, the merit-based incentive payment system, that's MIPS, and other value-based payment programs. There are three things I'd suggest revenue cycle organizations endeavor to build into that client relationship. First, you can routinely alert client practices to the existence, the risks, and the benefits of various value-based programs that may affect them. Second, you can keep client practices apprised of important due dates when you have to submit an application, when you have to declare certain choices. Provide guidance and or technical support for your client practices to access and submit their data to the vendors they've engaged to help them with their value analytics. Now, the unique position that revenue cycle organizations hold with those clients relates to three elements. Revenue cycle organizations often have a closer relationship and deeper knowledge of the insurers, that their requirements in their value-based programs, than do the practices they serve. Even if unvoiced, practices are looking to their revenue cycle partners for help, both to identify and reap the revenue benefits from such programs and to avoid revenue losses. Second, the foundation for measurement of value is built on visits and claims. Together, visits and claims define the patient-doctor relationship. It defines the range and volume of services provided within that relationship and the range of diagnoses, injuries, and illness that drive individual patient needs. This is the gold standard data set that determines eligibility, both of practices for specific programs and of patients for specific measures. Finally, there is typically a foundation of technology in the relation of revenue cycle organizations with their clients. Revenue cycle companies routinely interact with the practice management and billing data of their client practices. They sometimes have a role in the clinical EHR data of the practices they serve. They can be of invaluable support to their clients to help them access and deliver data to the vendors that help them analyze and submit quality measures to CMS and other insurers. Mingle Health has partnered with many revenue cycle companies. Too often, revenue cycle companies reach out to us after one or more of their clients have already experienced a loss. Now, earned or not, revenue cycle companies are first in the path of blame that their practicing clients assign for those losses. In that relationship between us and the revenue cycle company, it's a nice way for us to get contact with a large number of small practices. You facilitate a relationship that would otherwise be difficult for us to scale. Now, in some cases, that relationship that we foster with a revenue cycle company is as a preferred vendor. So the revenue cycle company recommends our services to their client practices, and the client practices engage us directly on that recommendation. To others, that the revenue cycle company is a value-added reseller. Those revenue cycle companies typically maintain the vendor-client relationship, buying Mingle services at wholesale prices that they resell to their clients, and then add value by delivering the standardized data sets that we use to generate those annual quality submissions. In both cases, Mingle can provide the revenue cycle company with updates on the changing environment of program risks, opportunities, and deadlines, and help you keep your clients informed of those important programs and deadlines. Great question, Adnan. Thanks. I look forward to dealing with you and your clients.